Hello everyone, I'm Dr. Vidal. We are live on Tuesday Tips. This is our weekly check-in. We go over different topics in plastic surgery and I get to answer your questions. And because we are close to Mother's Day, I'm going to talk, this is going to be a short live focusing on Mother's Days. And it's funny because the topic or the title is what moms actually want for Mother's Day. And as a mom, I can tell you, we all want to sleep. But sometimes that's not possible. So what things we can give moms that are a little bit more intimate or a little bit more closer to what we really want. And I'm going to talk about what things we have here available to consider gifting loved one mom. So
No flowers, not chocolates.
not chocolates. No, not flowers. No, we want to sleep. That's the reality. We all want to sleep. But having kids, sometimes sleeping, it's not in the agenda. We can't squeeze that in as much as we want to. So what things we can do to look refreshed? So let's say procedures that can give us a little bit of a refresh without the big downtime of surgery. So we have the non-invasive things here, and those are great as gifts. You can give that as gift card. You can give it. For someone for like a spa day, and just include that as a gift to come to the office and get some refreshments. So the neuromodulators are great alternatives for that. They can. They basically paralyze the muscle and get rid or smoothen wrinkles basically in the entire face. But majority of the popular spots for neuromodulators is the forehead, the fine lines that are like the vertical lines in the frown. We have the 11 lines here between the eyebrows, and we have the crow's feet, or the lines that form when we're smiling. Those areas are the normal target areas for neuromodulators, Botox, Dysport, all of those that are in the market right now. They're great. There are temporary, so they last about 3 to 4 months depending on the neurotoxin. But they're very, very good in smoothing those lines. And you don't need to look frozen. You can have a natural result and a natural movement of your face with just smoothing some extra wrinkles that we don't want. Other areas that I think the neuromodulator works great is in the neck. I love to do platysmal lines and get rid of those lines that form when we're smiling and we're talking that cause more aging or an aged look in your face. Also, you can do it in the masseter muscle that slits the lower part of your face. You can do it in the deep angular oris muscle, which is the one that pulls the mouth lower, the angle of the mouth, and by paralyzing that muscle, you get a more youthful angle of the mouth.
You haven't done any of those on me.
Now, Willie, you're not a mom, okay? So you're not getting any of those treatments. But all of those are options. We always focus on like the traditional areas of Botox, but there are other areas that can also improve the aging of the face. So we have it special for Mother's Day here at Pure and Simple. That's Botox 15 is a Botox for only $399. That is a great deal. So I think it's great for a gift. Of course, it's great for you to get it as well. So if you're having surgery these days, check it out. And also, if you're coming with a family member and you're the caretaker, take advantage of the $399. It's a simple procedure. It's very quick. Can be done in like a 15-20 minute procedure here in the office, and you go back refreshed, so you can be all cleared up from wrinkles on Mother's Day. Skincare, I think it's a great gift. This is a funny story. I gifted one of my best friends. She turned 40 in February, and I gave her as a gift skincare products, and she was pissed at me, but I know deep down she was very happy because after 40 we gift each other skincare products.
But you're not 40 yet.
I am not 40 yet. No, but I'll be soon. So yeah, a lot of my friends are turning 40 soon. So this is a great gift. And for mothers, this is a great gift. If you go to my link tree, there is a link to how to download our Pure and Simple app, and you have there links to buy the skincare products. If you don't know the type of skin of the patient, what product to buy, you can just like regular, the SPF is great, and SPF is for everybody, every skin type. Even if you have rosacea or other eczema, other melasma, other conditions, SPF is good for everyone. Moisturizer is good for everyone. Peptides, vitamin C, those are good for everybody. Okay, I would be mindful if you want to gift like retinoids, all those products that are depending on the skin type and on like the skin quality of the patient. But the gifts that are like a little bit more generalized, there are options. So skincare, it's great thing to gift, and we moms will appreciate it to try to smoothen those bags and those dark circles that form with lack of sleep.
Baby bags, baby bags.
And fillers are always also great to rejuvenate the face with short appointment, small, a short or a minimal downtime to rejuvenate those dark circles or droopiness in our face, loss of volume that happens with aging. Okay, here we have available hyaluronic acid fillers, but also Sculptra, which is polylactic acid, and we also have Radius, which is calcium hydroxyl apatite. Okay, all of those are different indicators, but basically restoring volume. This to also help stimulate collagen formation for fine lines. Okay. But if you have a little bit more time, I wanted to talk a little bit about the procedures that moms can have. When we become moms, our bodies change. Our hearts change, but our bodies change too. And sometimes we seek some procedures to make us feel a little bit better in our skin. So all moms want to sleep more and feel better in our skin. So what procedures are the most common? The mommy makeovers are the most common procedure. It doesn't mean that if you have a baby, you'll need a tummy tuck, but a lot of patients end up needing a tummy tuck to restore the muscle position and the diastasis, or that separation, and also get rid of some excess skin that didn't bounce back all the way. So don't feel bad if that happens to you. Don't blame yourself. I have a lot of patients that are like, oh, because I wasn't too healthy, or I didn't do this and that. I mean, it's genetics really. I have patients that are this big and didn't gain much weight, and they have excess skin. So it doesn't have to do directly with like blaming yourself that you didn't do something particular while you were pregnant, and that's why you ended up with this. Embrace your new body, but also know that there are options to get rid of that excess skin if that's something that bothers you, so you can feel better with your skin. The other thing that is very common is breast procedures. Okay, and breast procedures can go from just an implant to restore volume, fat transfer to restore volume, or if you need a lift to actually get rid of excess skin and reshape the breast. What's the difference? The easiest way to know if you would need a lift or just an implant is to see the position of your nipple and areolar complex in relationship to the inframammary fold. So basically, you have your inframammary fold and the nipple position is above. That is the ideal position of the nipple. Once it starts to droop and this position of the nipple starts to this is a fold, right? Because the breast is under, just below or pointing down, then you need a lift because the implant is going to be up here and the breast tissue down here. So we'll need to reshape that breast, lift it, tighten, remove the excess skin, sometimes remove some breast tissue to reshape the breast, and add or not an implant. How can you decide? But basically, if you lost a lot of density of your breast and volume and you want to restore that volume, or keep your current cup size, then I would recommend putting an implant, because when we lift things and tighten the breast is going to look smaller if you don't add any volume to it. Okay, if you're okay being smaller, or you actually want to go smaller and you don't care about that roundness or cleavage that much, then you're okay with just getting a breast lift without an implant. Okay, There's not an ideal breast shape. I think every breast has its own qualities and characteristics, and everybody has a little bit different of what breast shape they like. I have patients that just want them lifted so the nipples are pointing forward, but they don't really care about the cleavage. In those cases, you're a great candidate to just do a breast lift to tighten everything up and lift them without the addition of an implant, okay? But majority of times we want that cleavage, we want that kind of fullness in the upper pole, which is the upper part of the breast. Those cases, it's better to add an implant to get that shaping, okay? And we have also patients that with breastfeeding and having kids, the breast enlarged and they will need a breast reduction. That's also a possibility, and we can combine that with a tummy tuck and call it a mommy makeover, okay? And what is this about the mommy makeover? We're Miami, right? So we put a little twist to the mommy makeover for moms, and now we call it mommy makeover. Mommy is mom in Spanish, but
Sounds the same.
Mommy makeover, it's with fat transfer to the hips to kind of accentuate that hourglass figure and Latina body that represents us here in South Florida and the Latin community, okay? So those are the most common procedures. Of course, like liposuction is also a common procedure that moms tend to request. It all depends on the skin quality. I have moms that have great recoil of the skin and retraction of the skin are candidates for liposuction. Most of us, and I say us because I had liposuction after pregnancy, will end up with some level of loose skin, and you have to be okay with that, especially when you're sitting. You're going to see some looseness of the skin. We lose ability or collagen quantity and elastin in our bodies when aging, and this elasticity of the skin changes. So I mean, you don't see anything when I'm standing up, but when I sit or when I bend, you'll see some excess skin. I have patients that are like, I hate it, I don't want that. Then a tummy tuck is better for you to get rid of that. But understand that everybody, even J-Lo, even a 10-year-old, if they fold, they're gonna see some skin folds, okay? That's completely normal because our bodies are mobile, are dynamic. We're not stiff, we're not Barbie dolls, okay? So having folds in our skin is completely normal. My kid has them and he's 2, so it's okay. But I understand sometimes that wrinkly skin we want to get rid of, and that's when a tummy tuck will be better for you. An excisional procedure of getting rid of that skin, okay? And last but not least, we all want to feel loved and valued. So I hope that everybody can spend time with their loved ones. When we think about what to do on Mother's Day, I always think that I just want to spend time with the people I love, which is, my family, my friends, of course, my little boy. So I hope that everybody gets to spend that time with their families. Being away from my mom, I'm not going to be with her on Mother's Day, but we always do something virtual and try to catch up so we can have that moment together. Some questions? No? 3 questions.
No, it's 3 p.m.
It's 3. 3 questions.
Okay. I really want to do my tummy tuck, but how long would I have to wait to fly back home?
Okay, good question. Majority of my patients come from out of town, so it's very normal for us to deal with patients that are flying out. So don't feel that you are alone or that you're going to be the only one doing that. We have a protocol that you have to stay here in Miami for a minimum of 5 days post-op. I will see you on 5 days post-op, and if everything is good, you're cleared to travel back home, okay? So majority of patients stay here around a week because I see you the day before the surgery and then post-op day 5 to clear you and make sure that everything is good.
¿Siempre usa la clean technique para aumento de pechos?
Clean technique. Me imagino que hablas de la esterilidad del procedimiento. Siempre. Lo otro que utilizo siempre es lo que se llama no touch technique o no tocar el implante. Eso tiene asociado una disminución en el riesgo de contractura de cápsula. Siempre que tocamos el implante, no importa que esté completamente todo estéril, siempre podemos añadirle bacterias al implante, aumentando el riesgo de que haya una respuesta inflamatoria y aumento de contractura de cápsula. Así que nosotros no se toca el implante completamente, se abre de donde viene en su ambiente estéril, se le pone salina con antibióticos y yodo. Eso pasa directamente al funnel, que es un envase plástico estéril completamente, y con eso va directamente al pocket o al bolsillo donde se creó, en el área de vida.
Y última, hi, I have a question on post-op. Arnica tea for bruising and swelling. For how long can it be taken?
Great question. I do recommend everybody to take arnica teas. You have to be careful. Some of those teas have bromelain in it. Bromelain increases risk of bleeding. So bromelain, I am okay with my patients taking it 48 hours after surgery. But arnica, strict arnica pills and teas are okay. How long after? It really depends on your amount of bruising. It's really in the first week, maybe 2 weeks. Depends on how much bruising you had, but the majority of times by 1 week to 2 weeks, most of the bruising is gone. You know, really, it's no benefit to continue those teas unless you like them. Okay, guys, thank you so much. I hope that you guys take advantage of the promotion. $3.99 for 2 years of Botox. That's an amazing, amazing deal. So, personally or a gift, take advantage of it. Check out the link so you can see the app, and you can download the app so you can see all the skincare products and all the things that we have available in our app. And I'll see you guys next Tuesday on Tuesday Tips, okay? Take care.
Okay, thank you, Dr. B.